Koutou everyone, tēnā koutou katoa. Welcome to the collaborative peer learning sessions for September on Patient Portal, our digital front door. I'll open us up with karakia. Ka karakia ahau mo tātou katoa. Whakataka te hau ki te uru, whakataka te hau ki te toka, kia mākina ki uta, kia mā taratara ki tai, he aki ane e te atakura, he tio, he huka, he hauhu, Tihe Modi order. Awesome. So kia ora everyone. For those who don't know me, my name is Nee Brunenberg and I'm the Digital Health Change Lead here at Collaborative Aotearoa. And I am your facilitator this morning. Today, my colleague Coral is in the background, keeping an eye on the chat and the administration for me, alongside me. Thank you. And I'd like to take the time to thank you all for joining us today in your busy day and joining us in our bi-monthly peer group. I see a couple of new faces, so I just wanted to give you a quick sort of introduction to who we are. So Collaborative Aotearoa is a national learning network. Our membership is open to all primary health organisation and community organisations who coordinate or deliver care and wellbeing services to the people of Aotearoa. What drives us is building on an equitable future, and also what sort of sits within the centre of us is upholding te reti o Waitangi, which is the centre of what we do. So we facilitate system change through collaboration with experts, community leaders and healthcare providers, and we believe in sharing knowledge and experiences so we can build a stronger and more connected future. So yeah, seeing you all here today, it's a true reminder that I think we're all in agreement that the use of Portal is sort of like a game changer for us at the very beginning, an alternative way for us to access our local practice. And it's a very patient-centred way of us to be able to respond to sort of the current healthcare environment. So thank you all for joining us today. Well, so we have quite an exciting agenda for you today, so I'll just jump straight into it. So first of all, I want to sort of have a quick glance at the latest Health Quality Safety Commissioner survey, have a look at what our whānau are saying about patient portals, whether they've heard of it, whether they use it across regions, followed by a short exercise using an interactive tool called Menti, which is short for Mentimeter. And after that, at about 10:20, we'll have our portal vendors joining us. So we'll have Centrik, Manage My Health, Health 365, MyIndici and Vensa, who will showcase some key features as well. And later on, around about 11:10, I'm hoping I'll have a timer to make sure we don't run over. And then we could open up the floor to some Q&As or any key discussions that you might have with our vendors as well. You are welcome to use the chat function throughout. Coral and I will both keep an eye on that and we'll try our best to answer as we go along. So I'll just quickly show you. I don't have a lot of slides. I just wanted to give you a quick state of the nation. Cool. So I'm hoping to let you know if you can't see the slides, but I'm pretty sure you can. So as portals become our preferred digital front door, many of us here in this sort of call can probably agree to that it's one of the amazing ways to access the local practice. And however, at the same time, as professionals and as leaders and communities, we need to work as a team, and I think it's important that we take this time to reflect and also sort of consider what our whānau are saying about the portals. So I'm particularly interested in the question that is run every quarter by the QHSC, and the question that's asked is, have you heard of or used a general practice online tool, Patient Portal? It's really interesting to me because although the HQSC is an online survey, it's a 2-week sampling period, which is a snapshot of what's really happening down on the ground. So according to this, there's only about 60% of us on average that know that a patient portal exists and they have used it. And a whopping 20% have heard of it, but they don't use it. So that's our current state. And then you've got 17% who have not heard of it at all, basically. However, I think if we examine it further, and some people might say through an equity lens, we can see that there's still quite a significant increase over time. Well, a slight increase over time, but there is, a persistent equity gap, I believe, in some of the groups that are being sampled in that period. Notably, our Pacific Islander patients consistently, that they're showing at the lowest awareness each year, with a further decline this year by the looks of it. And another sort of element of this particular question is, once more, if we go into the age groups of our responders, those who have heard of the portals, we find that our highest age group is our 45 to 64-year-olds, followed by our 25 to 44-year-olds. And surprisingly, our third highest group is our 65 to 74-year-olds as well, according to May's response. This was quite an interesting snapshot for me, because there's quite a bit of an even distribution along sort of the age groups. I think that could imply a number of things. One of them being that there isn't really a significant digital divide, I feel, among age groups, and an even spread like this sort of indicates that the healthcare practices or system is successfully engaging in those diverse sort of patient populations, I feel. And also the portal is designed in a way that is kind of user-friendly and accessible to a range of age groups, from younger to older patients, as you can see. And hopefully it can also signify sort of a cultural shift towards digital health tools, and it's starting to be normalised and more acceptable of all age groups as well. So it's quite an interesting find. So that's your May result. So, and there you have it for that part. I hope that it encouraged some of you to explore the PES portal for yourself if you haven't already. If you are a practice and you're interested in taking sort of a deeper dive, I encourage you to contact your PHO for access. For those practices who are currently opt out of this collection portal, you can also contact your PHO to join on the quarterly sort of cycle. If you are a PHO staff member and you're interested in sort of comparing the local data with another area, you can contact your PHO super user to get access. And if you're anyone else and you're really interested in what's going on, you can do what I did and go online and have a look at the Patient Explorer. And there's so many other questions in there that you could look at. This is just one of the many. So that's wanted to share that insight. So have a look, be curious, check it out, and who knows, it might surprise you like it did me with the age group. Tracking really nice with time. We've got 10 minutes left before we go into the sort of polling. Does anyone have any questions at this point? Oh, we've got a couple of people struggling to get on. Oh, thanks, Coral. You've got this. Awesome. Cool. All right, we'll move on to the next one then.
I was just going to say, Nee, isn't it interesting that I think even my own bias would have been that we would have seen a drop-off for those that are in that 61 plus age group of their either knowledge or use of. And I think perhaps that's a bias that others may hold as well, is that you kind of think, oh, it's more likely to be in the middle bell-shaped curve of our population as the higher users. But I found that slide to be the most profound, actually, to see that so close in terms of the usage and understanding of it.
Yeah. And also you can look at the comments. So if you are a practice and you would like to see what whānau is actually saying, you can actually access it. You have more access to it than we do. You can see exactly down to the comments and interpretation as well. Lovely, you have a question?
Mōrena kia koutou katoa, mihi ana kia koutou, e te whānau, anau mai hoki mai i te wiki o te reo Māori, ai mihi ana kia koutou katoa. Good morning, thank you, Nee, and thank you, Coral. So my question is around And it probably will be important when our vendors come on, our patient portal vendors. But when I think about the uptake and use of patient portals, it is around the ease of use. And so, I mean, accessing it, you know, how easy is it for, you know, like, so again, if we think about, you know, our most hard to reach naughty kind of patients. And when I say naughty, I'm thinking about my family because they are naughty. So, I mean, if I think about that and I apply that, it's, yeah, how easy would it be for them? Yeah, so they have got data. It's not an issue because they can get onto other sites. But, you know, what are the other things that they keep bumping up against that make it hard, that then it just gets too much, that then they just pick up the phone, and the whole idea of patient portal goes out the window. And if I think about one of the things that Sam Mertens has, so Sam Mertens is the president for the Royal New Zealand College of GPs, how she talks about patient portals in her own practice, and not just recently, but last year she said that she gets patients, she opts them in, as opposed to, you know, like they have this option, so she just gets them on. And so, I mean, that, you know, I mean, it would be good to hear any feedback that any of the vendors have around, you know, promoting, marketing, making it so easy that, you know, it's as easy as using the warehouse app or something like that. So anyway, that's just my thought. Ease of use really is what I'm really looking for. That will hold more in that space where practices will feel confident to be able to really, yeah, move patient portals as a really good tool for patients to use.
Kia ora, lovely. Yeah, no, noted, definitely. Ease of use is really important. And I think we need to test it. I think we need to continuously test it. It's not something that we go, yep, we've got a portal, it's ready, good to go. You've got to include that conversation in every time. Yeah, absolutely. And let them know that you've updated it too. Like, I feel like a lot of softwares, especially, I don't know about where you guys think about this with any software, any updates is not also very known. It's just your computer doesn't work, or it doesn't actually does what it needs to do, and then you realize, oh, you got to reshut it. It's the same thing with portal. They don't know there's an update, and it affects their user and their sort of experience around that too. Kia ora, thank you. We've got time for a quick live poll. So I've just put a QR picture in the chat function. So if you've got a scanner, please scan on your phone. If you don't, you can join through menti.com using the code which I'm about to share. Got a question here. Cool. Really hoping you can see that. Let's present. Cool. So we'll take a few moments. These questions will come live as you respond. Some questions are for everyone. If you are a practice, I encourage you to sort of answer from a practice point of view. If you're not from a practice, I still encourage you to answer it from a consumer point of view. In your experience, whether you can access your portal. And I'll spend about 30 seconds in each question. That's more than 20 seconds. Access seems to be quite the most common. So just a reminder for those who joined in late, if you wouldn't mind just scanning in the QR code in the chat and answer either from a practice point of view or a consumer point of view. Oh, some really cool responses there, guys. This last question is just, I note there's a few comments around workload, and that sometimes it can blow out our inbox management. Wanted to know whether you had any sort of strategies that you'd like to share on how to manage these sort of actions. Thank you for sharing.
You're waiting. Aha.
You're with us, Gary. You managed to get through. Oh, ka whai.
Indeed. Okay, we're here now.
Yeah. We are. We're just doing some polling. We're just I'm just trying to get confirmation from a couple of our, if we start waiting for someone from Al, but if you wouldn't mind, if our vendors have shown up. Oh, you are. Thanks. Well, we'll stop this up now. So thank you so much for taking part in that. That was really, really handy to capture some really cool ideas there. So now I am going to pass you over to one of our vendors. I've got a timer. We are going to run a little bit, sort of 5 minutes ahead, but sorry, behind, but that's okay. I'm happy to adjust towards the end. We're here till about 11:30 usually, so that's fine. So Al is from Centrik, he's web tools, so he is on the call with us. So if you would like to put your camera on, Al, and you're welcome to share screen. You're welcome to whānau.
Kia ora, everyone. My name's Al. I'm from a company called Web Tools. And this is on my right hand side here is Hannah, our implementation lead. We've got Bridget, head of marketing, who's driving this. So I'd just like to say huge thanks to Collaborative Aotearoa for organising this kōrero. And thank you all for your time for attending. I know it's time out there in general practice and primary care is pretty precious, so we'll keep this short and sharp. Just to give a bit of context, a full demo of all of the feature set of our Centrik product can take about an hour or more, and I've only got 10 minutes. So what I'm going to focus on here is making sure you know who we are, you know how we operate, and hopefully get you to understand how easy it is to transition from your existing portal and be interested in giving Centrik a trial. So on this slide, over the last sort of 3 years or so, we've brought to market a modern and user-friendly patient portal platform called Centrik. We've currently got 4 apps live in the App Store, including our own brand Well, which is the top icon on the right-hand side, as well as some white-labeled or branded apps. So we've got the Doctors app for Green Cross Health, we've got Local Doctors app for Tamaki Health, and we've got the Better Health Outcomes app for the Better Health Group. We've got a whole rich feature set you can see there on the left-hand side. I won't go into all of the details on that because that takes a long time. But the important thing to note here is that we release new versions of this product every 2 weeks. And we publish our feature roadmap in 9 months in advance of when we deliver these features. So you're getting an updated product every 2 weeks with new enhancements, new features, and you can see 9 months in advance of what's coming, what we're going to deliver. We're currently integrated with MedTech via the Alex API layer, meaning that Centrik works right now with MedTech Evo and MedTech 32. Although we've architected the system to be able to integrate with any source PMS using FHIR APIs, which is the industry standard for health. So that actually means we can integrate with PMS systems outside of general practice, even including the likes of pharmacy and laboratories. The important thing for us when we're building product is firstly to know the context, and this slide just gives you a bit of an insight into some of the things that are going on out there in general practice. We know it's tough. We know you guys are exhausted. You work incredibly hard. Being aware that there are even options out there for patient portals, I know is a big thing. So it's important for us when we're working in this context that we really understand the pains that you are facing out there in general practice. And some of those pains also include the tech. You know, from our point of view, you know, the health system generally has been pretty underserved in the tech space, and patient apps have been particularly challenging for some. So what we've done is bring a new modern version to market. The message we're getting loud and clear from general practice and all the hardworking folk out there is that you're tired. And that you just want the tech to work and you just want vendors to listen and act. So that's how we operate. We switched over. Next slide, please. The delivery through co-design is one of our signature services. Co-design is all about bringing the practice teams and the practice users into our product team. So what this means is that it allows us to understand the context of general practice. What we do is we send out a bulletin to our subscribers every 2 weeks, and what that bulletin tells us is what features we're currently scoping and what features we have in design and what those design options are. And it also tells you what features are being scoped and the scope of those features. So that goes out every 2 weeks to align with our product delivery cycle. And then every other week, we have a drop-in call with our product team. So that allows you as the subscriber to join with us, our implementation lead, Hannah. We have our head of design and we have our product manager. And it allows you to join in there and give us feedback directly on the product and the features that we're thinking of building and the ways in which we're designing that. It's been a huge benefit for us because we're hearing directly from our user base what are your pain points, and we're also hearing directly from you your feedback on the way in which you operate. So what it allows us to do is to understand where there's variation in the way you function in general practice, and so that we can build configuration into the product to support that variation. And it also allows us to understand where that variation is actually noise, and there's a standardized way in which we can build a product. What it's also done, the unintended consequence, is it's created a community where attendees of the Co-Design Club, they actually debate themselves in the way in which they operate. So we're actually starting to flush out all of that variation and really building community. And the Co-Design Club now, as you can see on the slide on the screen, we have a lot of fun, and we've formed a lot of friendships, and it's growing community to make sure that we're building a product that meets the user's needs. We also have local support and implementation. We have a responsive team based in Christchurch, so our support team monitors any requests that come through. Those requests aren't always for support in terms of issues, but we capture any questions that we have from our user base, as well as capturing any ideas for enhancements, which means we can continue to both respond to any issues in same-day response from our team, but it also allows us to improve the product iteratively through our fortnightly release cycle. We also have friendly and fast implementation support. So what that means is our team works with you hand in hand. We have all of the onboarding, the design collateral for collateral inside of your practice in terms of posters, the digital marketing to support your practice to communicate with your patients. That all comes as part and parcel of our onboarding cycle. One of the big differences with us is the patient registration process. So patient registration is easy. It's all patient driven. All the patient needs to do is download the app, enter the invite code that is provided to the practice as part of the launch process, and then they complete the registration process and connect with the practice in real time through a 100% match on a set of data fields. There is a really low barrier to launch, and that's what I really want to emphasize here. We have a free trial period and no implementation costs. And what we can do, given we're integrated through the Alex API layer, it allows us to run the Centrik integration in parallel with your existing portal. So if we go on to the next slide, Bridget. Oh, is that it? Sorry, go back one slide. The process goes, we get a contract signed. From that contract, we connect you through to your practice, connect Centrik through to your practice through the Alex API layer. We have an hour onboarding session with Hannah to take you through the easy steps to connect, test your practice, test the integration end to end. And then from there, we leave you for a month to trial end-to-end your practice. We check in each week with you to make sure things are going well. And then at the end of that trial period, if the product meets your needs, we're good to go. It's as simple as that.
Kia ora, thank you. Oh, you're just on time. Thanks for that. 10 minutes.
No problem at all.
For a minute there, I didn't think you were going to make it. We are running 5 minutes behind everyone, but that's okay. We are here till about 11:30, so we've got that extra time at the end. Thank you so much, Al. You are welcome to stick around if you want to have a nosy and hear about what's happening around there. I've got Sean now, so I've just going to find him out of my palette, which is, if only Teams give you like a order of alphabetical order, you'd be able to find someone. So apologies, guys, while I find Sean. Or Sean, wouldn't you mind just raising your hand up so I can see you? Then I'll be able to spotlight you.
That's cool. Good morning. I think
morning.
I think we've actually got Cameron doing the presentation this morning. So I think he's waiting to be let in He's the one that's probably going to take you through the presentation.
Okay.
Hopefully everyone can see that now.
Cool. So you got 10 minutes, Cameron.
Oh,
I'll put
the
the
time's
timer
ticking.
on. Yeah, put it on for you now.
All right, so we're not going to go into too much detail, but I want to try and give everyone just a good overview of what Manage My Health is and what we can do. And I guess also help you understand maybe what we can't do. So first of all, what is Manage My Health? You're looking at the various portals today, trying to understand that. But just as a general kind of guide, Manage My Health itself covers a couple of things. So it's a patient and a provider portal, which means staff have a staff side portal or a provider portal, and that's split into clinical, reception, and admin roles. And then you've got the patient portal, which is where the patients log in. They either view or do. So they can view health records, labs, etc. And they can do things. So they can order scripts, they can order appointments. In terms of our functionality, the actual portal itself is accessible either on web. So we have responsive web. So that could be on a laptop, could be on a tablet. It could also be on your mobile if you're using the browser on your mobile. And then we also have the mobile apps themselves. So both for the Apple mobiles or for Android. So you can download the apps on the App Store or the Google Play Store. And in terms of kind of what you can see in there, like I said, there's the view and the do. There's the scene of the health records, the labs. And then there's the doing, there's the ordering scripts, there's communication. And our team is based in Auckland. We've got another one of our team members here, Sean. He's just jumped in. And we're a relatively big team. There's about 20 of us in the office in Auckland. And you probably, some of you would know me, have met me. And we try to, wherever possible, engage with our customers, whether at events such as the PMANs that just happened, or traveling around to do training or do other events. So just kind of a general look at Manage My Health. It's the #1 healthcare app in New Zealand. Looks like there's a gap missing there. So that's based on app downloads. We are the biggest. We are the longest standing that I know of. In terms of numbers, about 1.75 million registered users. We do add about 30,000 new users each month. There's about 700 organizations connected to us. About 70,000 appointments, 50,000 repeat scripts, and 10,000 online payments per month, which is all of this is kind of growing by month. So that gives you a bit of an overview of where we sit within the marketplace. There's a little bit of history there because we used to be one company with MedTech, and I think 3 or 4 years ago we separated into 2 separate companies. But I know that a lot of people still kind of bundle us with MedTech, and in terms of access to Manage My Health, currently a practice does have to be on MedTech to use Manage My Health. All right, so functionality. Now, as far as I know, and I don't want to speak for any of the other portal providers, I think we are the most feature rich. So we've got kind of the big 3, as we call it: appointments, repeat scripts, and labs. That's pretty standard. In addition to that, we do have the access to your health records. We have a messaging service, which we call secure messaging or secure mail. And that also includes the one-to-one messaging that you can do with your practice. And it also includes what we call group messaging. So sending bulk messages out that can be filtered by provider, gender, age to your patients. We not so long ago launched SMS, and that also allows for bulk messages to be sent out. We now also have one-to-one SMS. That does require MedTech 7.3. We've got a number of automated reminders, so appointment reminders. which can be by email or can be by SMS as well. We've got our recall reminders as well. You've got a health summary. As a patient, you have a health summary that you can see, and this can be exported and shown in an IPS summary format. So really useful for patients that travel. We find that when they go overseas, they like to use that to show any medical professionals their immunizations or their medications. So something that is becoming more and more popular. Health indicators, they're like little graphs you've got in the portal that show various metrics. Does require a bit of setup at the medtech end, but it is available. MMH referrals, and I'll show a screen later in medtech to kind of explain some of this. But there's a number of referrals that work through Manage My Health that are based in medtech. We have an additional pay online module, which is a prepayment system. So ordering scripts and appointments, you can capture that money upfront from your patients. You don't need to do any follow-up debt collection. Okay, and that will pull through to medtech. It'll go onto the patient's account as a credit. Video consultations is another feature. Again, there's a lot of other portals and solutions out there for video consultations. Shared electronic health records, so the SEHR as it's called. I'll touch on that later. Shared care plans, so that's creating a care plan around a patient and adding team members to that. And one of our newest features is the Discover Health. That's the essentially the health content that's available in the portal. So
a couple more minutes there for you, Cameron.
Yep, I've only got a couple more slides. Okay, just wanted to touch on health equity. Here's a little picture of the login screen, the dashboard. So we are on the zero data program, which means if a patient is using their mobile, they've run out of data, that they can then use the free or zero rated data system to access Manage My Health. We do have Te Reo Maori in the portal. That's available. Can you go up, please? Excuse me a second. Sorry about that. My daughter's sick today, so she's just jumping in on the webinar. As I said, language, Te Reo Maori. We've also got the shared electronic health record network integration, which is where you create a network of practices, share the health record, so very useful for hospitals. In Northland, we have something called the hospital link, where hospital documents like discharge papers can go direct from the hospital to the patient's portal, and they can be discharged quicker. And that's something that we are also expanding to lab results direct from some of the lab, the internal hospital labs and the external labs. So we're really pushing the health equity side of things. And let me just, I'm kind of rushing through here, sorry. Multi-channel onboarding. So in terms of getting patients on board, we've got a number of methods. You've got the bulk email, which sends an invite out to all patients. This can also be done on SMS. There's the express self-registration where the patients sign up themselves, and this can be done via QR code, or you can use just a web link in an email, or you can also use a 4-digit code for your practice. Of course, you have the individual patient registration in MedTech that you can do one by one. And we also have a demographic update system where the patient can update their demographics. That's going to pull through to MedTech to the reception inbox, and you can accept that and update your records. All right. And
I'm going to have to get you to provide us those slides, Cameron.
Absolutely.
Yeah, so if that's all right with you, we'll just move on because we've got now Cornelius from Health 365 coming in. You're welcome to stay, Cameron, and team. If you want to stick around and listen and stick around for Q&A at the end, you're welcome to do that as well. So thank you so much for doing that and showing us the demo. Some really cool features there. I didn't realise there were some things that had updated with Manage My Health, to be honest.
Well, thanks a lot.
Awesome. Cornelius, we can hear you. We can see your screen. Are you all good to go?
You can see me?
Yes, we can hear you. We can see you now.
Okay. Can I see the screen?
Yes, we can see your screen.
Can you see the Health 365 screen?
Yes.
Yeah. Okay.
So
my name is Cornelius Durven. I work for my practice as a commercial manager. And I know I only got 10 minutes, so we'll talk fast and try to show as much as I can. But before I show you something, basically, my practice, Health 365 works quite different from Manage My Health and ConnectMed and other PMS, other patient portals. We do not extract all data. So that's what the other patient portals used to do, or still do. We do not extract your data, which is from an architectural point of view and from a data point of view quite important. Instead of extracting all your data and putting them in a separate database, what we do is we send a query to your practice database, which allows the patient to see the lab result and make the appointment. So this is a much smarter way of running a patient portal. So if you just constantly extract data, your database is getting bigger and bigger and bigger and bigger. You log on to the database, which is not really real time. The way we engineered Health 365 is simply very clever. The other thing about our big point of difference is if you look at the Health 365 screen, we're using very smart graphics. We had a good graphic designer, and the reason we did was because we know that people don't like reading. People used to look at the screen for 7 seconds and then make their decision. If it's too much reading, they go to the next page. This was 5 years ago. Now we know that people look only 3 seconds at the screen, too much text, and they move on. They don't have the time to read it. So therefore, we work with pictures. If people see pills and notes about prescribing, if they see calendar notes about appointments. So this is a very smart way of working. We also, I believe, we're the only patient portal who works for different PMS vendors. So we integrate with my practice, obviously, but it also works with Medtech 32 and it also works with Evolution. It's also a point of difference. But to give you a quick overview, one of the things we've done, and again was talking to a clever graphic designer, you can put your own logo down here. And the reason that's important is that when patients log on and they recognize the GP or they recognize the medical center because their logo is here or a picture is here, that gives them more confidence about using it. It looks familiar, I can see my doctor, yes, this must be okay. And then actually using these styles, it's very simple, very clear, very concise. People are not confused. They don't have to accept terms and conditions. They don't have to read the whole page, or it's just extremely simple to use. When I say extremely simple to use, that's for the patients, but it's also for the practice managers or the people who manage the portal from the practice point of view. Very, very, very simple to use, which is important. Now this is our demo portal, so you might have some funny patients in here, but patients just can have a look at what's wrong with them. They can look for more information if they want to. What does this all mean for me? We send them to reputable databases to see more about this particular disease. For the repeat prescriptions, again, it's very clear. It's like shopping. They basically click what they need. They can make changes if they want to. They can collect it at the surgery. They can send it to the pharmacist. They can send it to Zoom Pharmacy. They can send it to Pill Drop if they want to get it delivered to their home address. They can pay immediately. very clear picture, very, very easy to use. I don't want to go through all the different functionalities because I think it's similar for everyone. We all basically deliver the same functionalities. But again, if you look at this screen, it's very clear, very concise. So one thing what I should show you is with the appointments. Down here, this information, every practice can change that. They can adopt it on the fly. And during COVID, obviously, and all the appointments stopped with the patient portals. Our GPs, they could change, or the practice managers, that could change that in an instance. And during COVID it was very, very important. So it is very flexible. But with flexibility often comes complexity. We don't do that. We just keep it always simple. The patients can look at their tasks. They can look at their lab results. They can get more information about their lab results if they want to. We graph their lab results. That's a feature many GPs, many patients do like. If you're diabetic, you want to know what is your HbA1c is over a period of time. Just one value is pretty meaningless, but if you can see a trend, then all of a sudden it starts making sense. We have all the measurements, and again, people can pick up trends if they want to.
A couple more minutes there, Cornelius. I'll just have a couple more minutes there.
I'll be faster then. The online chats, that's functionality used by many, many GPs. We tell the GPs, if you start using this, please do charge the patient, because if you don't, they keep on sending you messages. But if you charge $10 for every answer, then it becomes a very useful tool. But you don't want to be inundated by messages all the time. The care plan, that's the last thing I will show you then. That's basically, again, very concise, very clear, very simple. But these are the goals. This is what the practice will do. This is what the care team is. And the care team could be a number of, it could be the pharmacist, the GP, the physio, the midwife, they can all contribute to it. We have online payments, just like everyone else has. We got accounts where they can pay, and we have a user log, just like everybody else. Oh, look, so here's my picture now. So you can put any picture you like on the screen to make it look familiar for the patient. So you got any questions or?
That's we'll save the questions to the end if that's okay for you, Cornelius. You're welcome to stick around. We do have Imran from MyIndici up next. So thank you so much for sharing your work and to our group with what Health 365 has to offer. Imran, if you are there, you're welcome to share your screen, and we'll try and find you and spotlight you now.
Thank you very much. Can you hear me?
Yes, we can hear you and see you.
Okay, brilliant. Hello, everyone. Good morning. So my name is Imran. I'm not sure why I am still seeing that I'm muted, but it's good to know that you can hear me. It's very strange. All right, so I will present MyIndici here, and thanks for giving me opportunity to show that. So what I will do, I will share my screen and I will log in and I will show you that what MyIndici offers actually. Okay, so if you can see my screen, can you please confirm? Okay, brilliant. All right, so that's MyIndici. I'm showing you the web version because it's much easier to show. Apps are normally very difficult to show in the Microsoft Teams. So this is the MyIndici web version, and it comes with Android and iOS apps as well. I will log in as a test patient, and let me just show you when I log in. So Indici do offer the single login for a family. So for example, if there is a family with minor kids, so they can use the single email account to log in, and then they can switch between the different accounts if they want to see the children's record. So I will just select a profile and I will log in. So this is the MyIndici dashboard. Now there are a lot of configurability available in Indici, and these configurations are actually managed by the practices themselves, that what sort of options they want to open on MyIndici. The configurations is actually available at 2 levels. One is at a global level, which is the practice policy. As an example, if the practice do not want to open the clinical note, so they can basically enforce that policy, and that policy will be applicable to all the patients. So we call that a global level configuration. And the other is at the patient level. And the patient level configuration means that they can choose actually for a specific patient. For example, they cannot book an appointment. Again, this is the practice policy. They can apply on a practice, global, or a patient level. And then there are a number of configurations, actually, those are available in Indici. I will not go through all of these, but this is how the practice actually manages their MyIndici setup. So for example, if they want to allow the same day booking to the patient, so all of this can be managed by the practice. So going back to the MyIndici, so there are a number of options. So this is my patient who actually has the full configuration enabled. And on the left-hand side, or you can see the different menus like booking an appointment, messaging to a GP, sending a repeat script, test results, viewing diagnosis, immunization. So all of these options are actually available to the patient. Now, if I want to see my appointment, so you can see that I have one upcoming appointment. Clicking on the appointment will give me the opportunity to book an appointment with any provider, which I can select from here. And I can see the next available slot for the GP, and I can pick an appointment I can book with the selected provider. At the same time, I have the opportunity as a patient to view my upcoming appointments or view my history of all my appointments. The next section I'm going to show you is the messaging section, where I can send a message to my to my practice. Now there are a couple of things that I want to highlight here. That messaging. Now a lot of practices has actually switched off the messaging feature for the GP. So normally they have enabled the nurse so that they can basically save the GPs or the time. So that's where basically, again, as I mentioned, that basically that's where the practices actually controls that who they can send a message as a patient. So this is a messaging feature where I can select a provider or I can select a nurse and I can send them a message. The next section is medication, where I can send a repeat script request to my GP. I can select which medication I want. I can also see the history of requests that I have sent, along with their statuses that it has been approved, it has been sent to the pharmacy. So this is actually available. Similarly, I can see the history, I can see the long-term, and I can select and I can request for the repeat medication. Now on this test practice, what I have, that patient actually has to pay upfront before submitting the request. So you can see that it will ask me to basically, before I proceed to the payment, I have to, before I proceed to the script request, I have to actually request for the payment. Again, this is where the practice manage. If they don't want to enable that feature, so they can simply switch that off. All right, and the next part is where I can see my inbox. So this inbox includes the lab result, document, and all the relevant sort of inbox item that has been enabled by the practice. So as a patient, I can see those results. I can see my diagnosis, long-term diagnosis, recent diagnosis, all diagnosis. I can see that under the diagnosis section. I can see my immunization history, which immunization I has been given, which are overdue, and those are administered immunization. And if I wish, I can print my immunization record straight away from here. So this is very important because sometimes I need my immunization history, so I can straight away print from here. I can see my allergies record, what sort of allergies are recorded on my file. I can see my timeline. Timelines are actually the patient clinical notes. So this is basically showing me the last 60-day clinical notes, 180 days, or I can see all my clinical notes. As I mentioned, all of these are actually managed by the practice. So this is the practice decision that A, that they want to enable notes, B, how long they want to enable the notes. So this is managed by the practice. I can see my vitals information like blood pressure, weight, height, BMI, and these are all graphable. I can see my reminders. Reminders are more sort of, in practice words, they call it recalls, but we are showing them their upcoming sort of recalls on MyIndici. The resource section is very important. Sometimes it happens that, for example, the staff, the clinical staff, GPs, they want to share some informative videos. So for example, if it's a diabetic patient, so they can share some clinical resources with the patient so that the patient can see those. These can be videos, these can be documents. And finally, we have the account section where patient can see their balances, and if required, they can also do the payment. So that's all about MyIndici. Again, you can see earlier I told you that Indici actually you can link multiple accounts with single login, and that's where I can basically, I as a patient can switch to different accounts.
So thank you for that. We've just run time. If there's any sort of last minute updates or any key sort of items that you'd like us to capture, happy to discuss offline, and we can put together like a really cool one-pager matrix. I think for our viewers, I think they're quite keen to not compare and contrast, but actually have that knowledge so they can make informed choices for their community. So yeah, anything useful, I'm quite keen to catch up with our vendors post this call. So thank you so much for your time, Amran. We've got Philippa from Vensa, and shortly after we will have a bit of a Q&A, so you're welcome to stick around and help answer some of the questions. If you come across a question in the chat, I invite all vendors to help answer that if you've got the answer to it. Otherwise, I did pop in a bit of a resource in there. We did a little bit of comparison last year in November, which needs a bit of updating. So hence why I wanted to have an offline chat, which we will reshare on our webpage as well. So thank you so much.
Thank you. Thank you very much. Thank you.
Let me find Philippa for you. Philippa, if you're welcome to, oh, there you are.
Thanks. Yes, thank you. I'll share my screen and I'll jump right on. Yeah, I'm Philippa. I've been with Vensa for the last 2 years, and I'll quickly run you through just sort of like the main highlights. We are integrated with MedTech32 and Evolution via the LX APIs. So we securely connect there. We're currently connecting to about 3 million Kiwis annually through the range of our services. And our clinics, if they use the patient portal, they do tend to save a lot of costs because we do provide like a bundle deal with our messaging service. I'll just kind of run through a couple of highlights just to kind of give you an idea where we might differ to other portal vendors. Any further details we'll have to sort of get into a proper demo. We do provide shared email signups for patients just to make sure that everybody gets the chance to use an online portal there. We do have the ability to support a number of different clinic sizes and their specific needs. So we do customize depending on clinic size there. And we also support clinics with multiple locations and shared databases. And then we also have outstanding patient and clinic support, which is often mentioned by our partner clinics there as well, and our quick response time. Quick overview on the appointments, just a couple of highlights. We do have customizable appointment slot length depending on provider and service. So you can have like double slot bookings, not just the standard 15 minutes or 20 minutes. And the patients have the ability to search for different services to find clinicians who can actually deliver that specific service that they're needing. We do provide appointment prepayment depending on services as well, and depending on age and community service card status. We do also check for current account status, so you get customized payment screens depending on the current account credit or balance. And also when a parent is booking on behalf of like their children, for instance, we do fill in the dependence info straight into the appointment book slot there as well, just to avoid any extra manual handling. For prescriptions, just a quick overview, we have a pre-script triage check just to ensure the patient has had a recent appointment. Here again, the patients can prepay their script or pay with their account credit, or choose to pay later at the clinic, where we then automatically send the invoice to the patient. All of the review and the approval process happens in MedTech Evolution itself, and upon approval, all the invoices and the payments get automatically created in the PMS, so there's no manual actions or reconciliations needed whatsoever. Another highlight of our patient portal is actually that it also includes a provider portal. So we do have the options here to run different health campaigns. A lot of our clinics are already using the automated smoking cessation campaigns, and we're working with a number of PHOs to fine-tune our childhood immunization outreach. Here the goal is to really increase the compliance and the immunization rates, and enhance the funding for the clinics. We screen for barriers to access care and parental mental health and domestic abuse.
Got a bit of a connection loss there with Philippa.
Thanks so much for, I'll just, while she connects back in, can take over. Great. Just share my screen. So thank you so much for having us. I'm Sarah. I'm a registered nurse and have been with Vensa for 8 years. So we're really excited to connect with everyone today. And what's near and dear to my heart is the public health outreach. So as Philippa had mentioned, we are co-designing with all of our lovely partners and clinical teams right across the country. So we have screening for maternal and paternal mental health. We know that kind of the early transition with having new babies, there's a lot of isolation and anxiety. So just ability to assess and provide value, and also what is normal around, kind of sleep. And we also have support for early access to community services. So whereby, those community services are an extension of the GP and can help wrap around those services around the patient, such as with a lactation consultant, mental health, occupational therapist. So it's a very customizable system, and it's that complete wraparound system, both for GP and our community teams. Sorry. Jumping ahead. So we've got the push notifications and secure messaging. So we are also a multi-channel, so we can deliver by SMS, email, and push notifications. Patients can securely access those notifications through their portal, and also via the SMS and email. What with the portal, so once the patient has been delivered the full access to their portal, they can access their health summary, so conditions, health monitoring, health history, their care plans integrated with Healthify content, immunization history, medication history, those shared clinical notes, and also lab results once they have been filed and shared with internal comments for the patients, and clinicians have the ability to easily exclude lab results from being shared across the portal, especially before they kind of want to have that telephone consult conversation with the patient. whānau, we support the whānau as they can securely access their shared dependents health records through unique PIN entry. So just enabling new capabilities and better patient access, as many Kiwi families share an email, especially those elderly populations and people with disabilities. We know about a quarter of the population has a shared email. So just opening up that access. We also support with payments. So as Philippa mentioned, we've got automated rules in the background for delivering payments within the portal. So prepaying for appointments, the ordering of scripts, as well as for collecting current and aged debt. So no more statement runs at the end of the month, as well as for those telephone consults or any consults where there's an outstanding invoice at the end of the day. The system will automatically pick it up, notify the patient, and we clear up both the current account as well as any outstanding debts. And everything is done administrative-wise on the back end. So we've got the automatic reconciliation of all of the invoicing that happens, receipting to patients, and of course that payment collected and into your bank accounts. So that's always win-win. So who we are very much like many of the teams here, very collaborative. So we work with, over 50% of GPs across the country. So really fortunate to work with so many lovely teams, as well as our PHO partners. And we're, of course, continuously developing, adding new features based on your needs and feedback. So we'd love to hear from you and would love to collaborate. So we are very grateful for the 10 years that we've spent together collaborating and developing. And myself and my lovely lead, Philippa, are here to support you along the way. Right.
Oh, kia ora. Thank you so much, Sarah. Thank you, Philippa. Sorry, you did drop off, Philippa, but I think you've just rejoined us. Really cool, really cool. Yeah, I wish we had more than 10 minutes each. I think it's really important that we give you guys equal amount of space to share and yeah, just give you guys that platform. Basically, it's something that our members have always asked for over the years. It's something that I think will be continued to ask from us, and I think it's important that we sort of catch up regularly, I think, as well, moving forward, a possibility there. So now, if you guys have some time, I'd like to jump in some Q&As. We do have a couple of questions which I'm quite keen to ask. Sarah has put in the chat, do all the portals have open notes where you have an ability to allow patients to update their own contact details? One of the biggest issues for practices is having up-to-date contact details. Any thoughts on that? Al, I thought I might ask you first.
Yeah, happy to jump in there. Thanks, team. So in terms of open notes, that's been a really interesting journey for us. So when we've launched our first version back at the end of 2021, we did that as we have along the way in partnership with our subscribers. So we were with Better Health Group at the time, and the intent was to go open notes with all practices. So we launched version 1 with open notes. And what we learned quickly from that experience was that there was a massive variation in the willingness or comfort of practices and actually practitioners within practices to have those open notes. So we've introduced a whole bunch of configurability into our open notes as a result. So there's the option there to turn open notes on or off. So you can, it's a binary switch. but we also have the ability to set a date after which notes become visible. So what that does is support practices if they're going through a change management process to introduce open notes. So for example, you can launch today and you can have notes turned off and set a date in the future after which they become visible, or you can set a date in the past after which. So if you've gone through a change management process and maybe that was 3 months ago, then you can set the date for those notes to be visible from that date. So it can be in the future or it can be in the past. What we've also done after feedback from practices is to introduce a time buffer. So you're entering your notes in the system and you can configure an hour period, whether it be 4 hours, 48 hours, where those notes don't present to patients until that time period has been changed. In terms of contact details, one of the beauties of our patient registration process is that we need those details to be matched when you do your app download and registration. So it goes through your first name, surname, date of birth, mobile number. And a mobile number tends to be the details within the PMS that is most often out of date. So we have the ability to contact the practice directly if those registration details don't match, and get those details updated in the PMS. So it tends to be a small percentage of the registrations, but what that does is ensure that the details within the PMS are up to date at the point the patient's registering. Thank you.
Kia ora, ka pai. Anyone else, Cornelius or anyone from Manage My Health or MyIndici that's still online that would be able to answer some of that question around open notes and being able to write back to the PMS maybe?
We started our patient portal, I think, in 2014 or 2015. And to the best of my knowledge, there was one GP who was going to do open notes, and his name was Damien, and he was in Hamilton. And everybody thought that Damien was slightly mad because you were not going to share your consultation notes. You know? Now, 10 years later, I think nearly everybody's doing it. I agree with Elle. What we do is the same as them. You share your consultation notes up from a certain date, and then most GPs are very comfortable with that. Other GPs that basically shows all their consultation notes, even historical ones. But there seems to be now very few GPs who are not sharing the consultation notes. In the end, the patient can always write to the GP and ask about the consultation notes. So, but it's a bit of an education process to the GPs who are new to a patient portal, and lab results and appointments and all this, and that's never an issue. But a consultation note is always a discussion. But if you have that discussion and explain the benefits, then nearly all the GPs are using the open notes functionality. It's now extremely common. I think it's rare for the people using Health 365 not to share their notes. But it was a process. That's the statement.
I think there's a lot of there's definitely a lot of mixed messages around there, and I do hear our peers in our sort of network. There is a real concern with some sort of population that are high risk and share contacts and share access, which is something that we here at Collaborative Aotearoa we acknowledge, but at the same time we want to sort of support them as well, because it is quite tricky and quite difficult to open your notes to your whānau and the population that you serve as well. So we definitely know that. The numbers are, we did a quick poll. I don't know whether you've noticed, but we will put our polling results on our webpage if you are curious to see what our viewers have put in. There was a bit of sort of discussions around who's got their function on and off. So it'll be interesting to see what you think. Not a large number that has it sort of switched off, but there are still a significant number out there that has their open notes switched on. So that's quite reassuring, I think, as well. And
we have the ability for one particular patient, if you as a GP think it's probably not good to read the notes, that we can block them from reading their consultation notes. So, and I think the other PMS plans have a facility as well that you simply can block. For a number of patients, a small number, it might not be good. But yeah, for those ones, you simply block that functionality.
Yeah, absolutely. Yep, you can reconfigure it. Sarah, I see you've got your hand up. Have you got a comment to say on that?
Yeah, thanks. It's just I guess on the second side of the question, just around those patient contact details. So we know that is so important, especially the ever-changing environment and being able to get in touch with patients in a timely manner. So one stance that we've taken in our build is just constantly where we just have quick confirmation. So whereby when we are doing outreach via SMS or portal, we get patients to confirm their mobile number, and that again always updates into the PMS. So we know that as well as email address, so whereby the clinic kind of always constantly has the most up-to-date contact details, because we know that there's multiple methods that we need to contact patients for. So yeah, no, really great question. Thank you.
That is a good question, and thank you so much, Alan. Cornelius. Cornelius, you had your hand up there.
Yes, may I have a suggestion? I quite like this format, talking to a lot of people all at once about the latest technology. Could we organize a forum like this about AI? Patient portal has been around for 10 years, and I think nearly every practice is using it now. But AI is moving incredibly fast. And to keep up to date on AI for a practice is simply very, very difficult. I mean, 12 months ago, we all talked about Nebula. 6 months ago, we all talked about Heidi. Today, many people are talking about second opinion. So what I suggest you could do is have a similar forum, but then about AI.
Fantastic idea, Cornelius. Yeah, you and I are on the same wavelength. I feel like that's another beast we will tackle another time, I think. So we are reaching towards the end, and I do feel I'm very conscious that we're almost 11:30. We try not to have these run longer than an hour and a half. So I am going to close us off with karakia. Happy to connect with our vendors again post this meeting to update what we've got. We want to make sure what we're putting online is correct and accurate and up to date. And we want it to be a continuous relationship too. So yeah, AI could definitely come into that conversation later in the future. So I'm going to close this off with karakia. So yeah, karakia ko ranginui I tu nei, ko papatunu ki utu ko tia nei, kia tau, kia rongi Mārie, kia runga I tō tātou mahi tahi, haumi e, hui e, taiki e. Thank you so much, everyone, for joining us. I don't think this is the last time we will connect. This has been a really, really engaging conversation. I feel like we've only scraped the surface of it, to be honest. And also any sort of findings we've put together in this poll, I'm going to put it on our website after clearing it off with you vendors online, and then we'll share it to our network as well. So this recording will be available as well at the end of today on our YouTube channel, and also our webinar channel at colab.co.nz. So yeah, feel free to visit that after today and watch the recording, share it with your peers. We are in it together. We are here as a learning platform, and I think it's important that we come together and serve the community that we serve. Ka kite, everyone. Thank you.